Okay, hi. Okay, students. So this is the students' practical manual or workbook. Okay, contain the instruction, contain the details, and how you shall be involved during the practical. Okay, so some of the disclaimers, some of the introduction about this workbook. Okay. Okay, so this is some of the learning outcome. Okay, you shall be able to conduct the patient interview and effective communications, identify the DRP based on the interview, develop the plan based on the DRP, propose the implementation based on the plan, and recommend suitable follow-ups and monitoring measure. Okay, so you also need to bring some of the references such as MIMS, BNF, some of the A4 paper. Okay. All right. So do you still remember about the PPCP process? We have five of the interrelated steps. Start with the CLAD, okay, and then steps two, assess, plan, implementation, and lastly is the follow up. All right. And then okay, this is the PPCP framework. Okay, we have five steps. Okay, in the page 6 we also have the learning activities. Okay, some of the we might follow the time. Okay, but we will have some of the extra 1 to 2 minutes. All right. Okay, so first we have some of the briefing about the session. Okay, and then students need to read the manual. Okay, familiarize with some of the instruction. Okay, just 5 minutes. I'm pretty sure you shall practice and prepare before you come to the practical session. Okay, and then another 20 minutes for the group discussion. Okay, you can do the patient interview strategy. You can draft some of the question, and then you can do the role play. Another 10 minutes, you do the role play. Who will become the patient? The lecturer will become the patient. The lecturer will answer the question. Okay, same as what we will apply during OSCE letter. You as the students, or you will add as the pharmacist, will ask the question to the patient. All right. Okay, and then another 10 minutes, the lecturer or tutor will give the feedback based on the communication. I will encourage you to ask a lot of questions, to be very active during this session. Okay, and then after that 20 minutes, you can identify, you can justify and prioritize what kind of the DRP that this patient experience. Okay, 10 minutes, you present that DRP that you discuss in group, and then the lecturer will give the feedback. All right. Another 20 minutes, you develop the plan. Okay. You link the DRP that you identify in steps 2. Okay. You plan. Okay. You do the implementation, follow up, and monitoring. Okay. So 5 minutes, the students will present. Okay. 5 minutes, the lecturer will give the feedback. And the last one, you shall reflect yourself what you learned during this session, what you need to improve, and how you want to improve. All right, so even though it's a group discussion, but please remember that the OSCE letter will be conducted individually. So if I'm you as a student, I will use this session, okay, to ensure that I have the ability to interview patient, I have the ability to detect the DRP, what is the plan that I should do, what is the implementation, and how I can do the follow-up, monitoring, and evaluation. Okay, we are really encourage you to be very active, to ask a lot of questions to the tutors, okay, because we conduct this session in a very small group. One lecture will have 12 to 13 students. Okay, so you will have a very direct feedback with the lecturer. You can ask what is the tips, you can ask what is the advice, you can ask what is the expected answers and all that. Okay, and yeah, please make sure you be very active. Okay, the sometimes we need your energy, we need your question, we need your prompt as a student's point of view to ask question to the lecturer. Okay, moving to the step 1. Okay, still remember step 1 is collecting the information to the patient. Okay, this is the case. Okay, in the practical session we give the case to you. Okay, different with the OSCE session where it's a prompt case and it's an ad hoc case. But in the practical session, as a practice method, we give the case to you before you come to the practical. Okay, this is some of the template, or I would say this is how the OSCE session, OSCE question will be appear. Okay, later. So this is some of the interview component. Okay, the checklist, what we expect you to ask. Okay, in the steps 1. All right. And then this is some of the I would say informal of the communication skills, okay, like giving the introduction, eye contact, listening, okay, and all that lah. All right. And then step 2. Step 2 is you identify what is the DRP, what is the problem, okay, as experienced by that patient that you interviewed just now. All right, this is the category that we've learned in class. This is the subcategories, okay, some of the explanation. Okay, even though it's stated in group, please make sure you're able to identify it individually. Okay, use this practical slot effectively as a student. Okay. All right. And then what we add here, after you have classified and identified what is the DRP, okay, in the class we didn't learn what is the contributing factor that caused that DRP, but in this practical we are learn further, which is we learn the possible contributing factors that lead to that DRP. So how you can identify what is the factors? Okay, for example, if patient not taking any medication, the patient not comply, what caused that patient not comply? Even is it due to the patient want to save money because patients want to do not want to use all the medication because a patient might need to pay, or patients are not comply to medication because patient not really understand the instruction, or if the patients are taking some of the herbal supplement because any of the factors and all that. So in this step 2, additionally, you also will learn what is the factors. So how you want to identify this factor? You can refer to the appendix 1, PCNE, okay, page 5 to 6, okay, page 5 to 6. All right. Okay. And then you can present, you will present what is the DRP that you identified. Okay. All right, and then steps 3, okay, you come out with the plan, okay, specific plan, okay. That plan you can refer to the appendix 1, okay, page 6. Okay, step 4 is implementation. Okay, after you have that plan, okay, for example, is you want to do the recommendation of initiate or modify medication, okay, and all that. Okay, you will come with the implementation such as all this. Okay, inside the implementation, we also sometimes provide the patient education counseling, okay, give some of the demonstrations, education and all that. So in the step 4, you also need to demonstrate the correct technique based on this case. All right. Okay. For the guide for you to plan the intervention, you can refer to the PCNE on the appendix, page 6 as well. All right. And the last one is the follow up. Follow up, you can come out with the what you want to monitor and how you want to monitor. Okay. All right. For the what and how to monitor in stage 5, you also can refer to the appendix 1, PCNE, page 6. All right. So this is the template that you can fill in. All right. Okay. Now, still remember the last step, which is reflection. Okay, you can reflect yourself based on this practical, what you need to improve. For example, like maybe you need to practice more in terms of giving the counseling. Maybe you need to not become too anxious and all that. All right, and what is your action plan? Okay. Okay, now you've done with session 1, case 1. Session 2 or case 2 is the same process, but we keep it for the practical 2. Okay, it's the same work process, it's the same instructions, same checklist, and all that. All right. So this is appendix 1. Okay, appendix 1. Um, okay, you can refer to this. Okay, PCNE. Okay, how you want to identify the factors causing that. DRP. Okay, the intervention. And then the monitoring and implementation. All right, and then the last one is the checklist um, about the skills or checklist on how you can demonstrate effective counseling technique for both insulin and inhaler. Right? Okay. So yeah, I think that's all. Okay. If you have any further question, okay, please feel free to contact me, or we can have briefing session, a Google Meet, okay, to clarify some of the doubt that you might have. All right, okay. So please bear in mind, okay, I really encourage you to be actively participate. Okay, okay. Bye. Good luck.